Hi everybody, Zeev Simon here. I'm the creator of SurgicalMaster, the surgical training for dentists. Welcome to a lecture on aesthetic crown lengthening, and this is part 1 out of 3 where I'm going to be reviewing this process. And I'm going to start with meeting your patient, understanding their concerns, and also reaching a diagnosis and a treatment plan. And in part 2, I'll talk about preparation for the surgery and a digital simulation. In part 3, I'll talk about the actual surgery step by step and also share with you some of the challenges that I had and also show you the outcome, how it turned out to be. So it's very important when you first meet your patient to understand their concern, understand exactly what bothers them. Some patients will tell you that they have too much gum tissue showing or tissue excess or too little of it, which is tissue deficiency or both. So it's important for you to ask them exactly what bothers them so you can help them. And part of the process is also determining what is the ideal gingival margin. What's the best gingival margin that would suit their smile? So you need to create some sort of soft tissue blueprint, I call it a pink print, that will then guide you and let you know where tissue needs to be added or where tissue needs to be resected or a combination of the two. And that's totally critical for the success of the treatment. Now, aesthetic crown lengthening is a resective procedure. It allows you to selectively remove soft tissue, usually on the buccal aspect of the upper teeth, the anterior teeth, and that reduces the gingival display and also improves teeth proportions. So knowing this procedure, knowing how to perform it, has tremendous benefits for your patients. You can, number one, treat the excessive gingival display. You can improve their gummy smiles to some extent. You can correct all sorts of gingival asymmetries and imbalance in the gingival margin. And you can also improve the health of the tissue by removing hyperplastic gingiva or hypertrophic gingiva, and that again would improve the health. So there are tremendous benefits in understanding and performing this procedure. Now, the patient for this case had a few concerns. She was concerned with the appearance of her gingiva, her smile, the excessive tissue that was showing. She felt that she had very short teeth to her liking. And she was also concerned with how her upper lip looks when she smiles. She felt that this fold from within the upper lip was showing too much. And she also reported there was a dark spot on the buccal tissue of tooth number 9. So when this patient that is very young, number 1, is smiling, she was concerned that the inside of the upper lip was everting, and she was curious if something can be done about it. And if you look at it very carefully, you can detect that there is a relatively large frenum within the upper lip with a connection close to the gingival margin. And I had, the idea that possibly if we resect this frenum, we may be able to help with the lip appearance. So we'll see later how this worked out. So this is the frenum from a side view. So you see that the frenum connection is aberrant. It's relatively incisal, close to the gingival margin, so a good indication for a frenectomy. The other thing that was concerning to her was a dark spot or a dark lesion on the buccal gingiva. It seemed like a pigmented lesion, so that's one more thing that we need to address. And she was also concerned with her short teeth. We're looking at tooth number 8 that had 8 millimeter length or height, which is abnormal. We know that the normal height is about 10.5 millimeters on average. Tooth number 9 was also short and was 9 millimeters, interestingly enough. And there was some tissue that could have been resected to improve the teeth proportion. Now, the first thing that we need to do is try to explain to the patient why the teeth look short. And in this particular case, the reason is delayed eruption. The teeth were, so to speak, lazy to erupt. And the pattern of eruption was incomplete. So to understand that, we need to know there are two parts for the eruption process. There is an active process of eruption and there is a passive part of the eruption. Active eruption means that the tooth moves bodily from the jaw and through the bone and the soft tissue until it reaches a functional position. So that's when it ends. But really, if you think about it, active eruption occurs throughout life. It never stops, because if a patient is losing an antagonist, the tooth will keep erupting, what we call compensatory eruption. So active eruption never stops. So the tooth erupts from the jaw through the soft tissue, reaches a functional position, and then the soft tissue starts to retract, some sort of a planned recession. A sulcus is forming, the attachment is forming, and that is called passive eruption, because the tooth is actually not moving anymore. It's just the soft tissue retracting. So both active and passive eruption are responsible for exposure of the clinical crown. Now, if one of these two processes is not happening to the fullest extent, or both, the end result is short teeth. And that's exactly the reason this patient has short teeth and abnormal teeth proportions. So we know that in order to get proper teeth proportions, we need to resect some tissue, ideally on both the central and the lateral incisors, and that would address the issue of short teeth and at the same time reduce the excessive gingival display. So the question is, what can we do to help this patient? What would be the treatment plan that is recommended? So the first thing that I was thinking is, let's start with the aesthetic crown lengthening, remove the actual redundant tissue, and I'll show you the process step by step in lecture part 3. And if you look carefully, part of the tissue to be excised on number 9 will include, or likely will include, the lesion. So we'll be able to remove it at the same time. So that's, killing two birds with one stone, so to say. So we'll be able to remove the lesion. Once we're done with that, we can also resect the frenum, create a resection from the lip part and from the attached tissue, and possibly address the concern with the lip. So this is my treatment plan: aesthetic crown lengthening, removal of the lesion, and performing a frenectomy. So the question is, what is next? The plan is to perform all those 3 procedures, but we need to decide on the ideal gingival margin. So part of the preparation for the procedure is obtaining diagnostic casts and possibly creating a wax-up or a mock-up. And I feel that one important thing that helps me plan the procedure is create a digital simulation. And that's something I'd like to show you in part 2 of the series. So I look forward to seeing you again and sharing with you how I perform this digital simulation and I prepare for the surgery. And I'll see you in the next video out of these 3-part lecture series. So I hope you enjoyed this part 1 of the series, and I look forward to seeing you in part 2.